Wonderful. So, hi, everybody. My name is Kristen, and I am excited to be here with you today. I know everyone has busy schedules. So, again, thanks for coming and learning about the healthcare benefits through Viago Health. So, I'm looking forward to just showing you how these plans can protect your health and your financial well-being. So, Clearwater, our plans here are designed to keep you in mind. So we understand that it is challenging sometimes to find affordable quality health coverage for an independent contractor or 1099 worker. And that is where we come in. We partner with Viago to bring you these, group rates essentially. So we always like to kind of start out with a nice little fact here. We like to let you know that 70% of people are typically on the wrong health plan. So many are overpaying or, missing out on the coverage that would truly help them. So that is where we come in to help you find the right plan and make sure that you are covered. So let's go ahead and dive in. This is just an overview of today's agenda. We're going to go through an in-depth overview of all of our plans and options, and then we're going to go over next steps and how to get started and make the most of the healthcare options. And we're making choosing the right healthcare easy. That is exactly what we're here to do. We want to be able to give you the confidence that you're selecting the best plan for you and your family, with no confusion and no, uncertainty. Just clear options designed to fit your needs. So, what are a couple of things that do set us apart? We provide healthcare solutions that truly work. So, here's a couple things. We provide a rich benefits package. So, we have comprehensive health plans, including, medical, health shares, dental, vision, plus $0 access to telemedicine. We have low monthly costs. So on average, our members are saving up to $4,000 a year with our plans, and that's just on premiums alone. We have simple, easy to access care. So we have a large nationwide network that is complemented by an in-house managed care team. So if you need any help, we're here to do the heavy lifting and make it pretty seamless. Again, our personalized support and comprehensive benefits are going to make you feel valued and connected. And that is our whole purpose here. So here's what members love most about our plans. Number one is going to be the 24/7 concierge telemedicine. So we provide round-the-clock access to licensed doctors who can diagnose and treat patients over the phone. This is not only primary care, but second opinion, a mental health triage. If it's used for urgent care as well. And if you need to be seen in person, they will absolutely let you know that. Second is our care coordination service. So, with our care coordination service, the goal is to make healthcare seamless for our members. So, we help members find high quality, fair price providers. And if you use our recommended providers, the care will be free. Our virtual mental health. So, all of the plans come with $0 mental health support through Amaze. And then lastly, we have our unique three-tier network. So with our tier one, you're going to have $0 care with our recommended preferred providers. Tier two opens it up to a nationwide PPO network with lots of doctors to choose from. And then tier three is going to be the ability for members to see out-of-network providers, just to add in that extra flexibility. And this is a story that we like to share. Terry Hooker he was a Clearwater, or he is a Clearwater member who faced a huge medical challenge. He had developed heart failure due to COVID-19, and he ended up spending 2 months in the hospital with his bill being $2 million. dollars. Um, as a member, Terry only had to pay $1,000, which was his member responsibility. And ClearShare covered the rest of his expenses. That means that, Terry didn't have to worry about medical debt. He could allow himself to focus on his physical and mental recovery. So we just like to share this because this is a powerful example of how our program can truly make differences in people's lives. Perfect. So let's go ahead and dive into what we offer. So we provide a variety of different plans to fit unique healthcare needs. So we like you to think of us as your healthcare broker, and kind of think of us as like Costco, if you will. We have our Kirkland brand, but we also have other products as well. So we have our major medical plans. We have our ClearShare plans, which are health shares. We have holistic forward plans. And then we also offer supplementals, including dental, vision, accident, critical illness. And then if there's a plan that is a better fit for
What
you
is it?
on the marketplace, we can absolutely help you sign up for that as well. So that's why I said think of it as a Costco type situation. We have our plans, and if they make sense for you, that's great. But if they don't, we can help you too. Like I mentioned earlier, you're going to have access to Amaze Health with all of our plans. Um, it's a 24/7 telehealth platform. And again, you're going to easily be able to download this app, get urgent care and primary care support, mental health services, prescription management. And again, if they need to see you in person, Amaze Health can pull up your plan and find a provider in person that fits within your network, which is really nice. So let's talk about how our care coordination program works. It is a simple three-step process designed to give you, affordable, excellent healthcare. So if you need labs, imaging, or any other major procedures, you're going to reach out to our care coordination team. You can either do that by emailing or calling. We're going to give you a list of recommended providers that offer high quality care at a lower cost. If you choose from our suggested recommended provider list, you're going to have your out of pocket expenses completely waived. So, again, this is here to support you and make it easier than ever to just focus on your health, other than worrying on these types of costs. Cool. Let's go ahead and break down the major medical plan options. So, our major medical plan options, we do have a couple here. These plans are going to function like your Blue Cross Blue Shield, your Aetna. Um, for the copay plans, if you visit the doctor pretty often, this is a great plan for you. It does offer low deductibles, great copays for doctor visits, prescriptions, and diagnostics. Again, you're going to get $0 for out-of-pocket care when care coordination is utilized on this plan. We do have HSA plans. So these plans are going to be perfect for saving on your medical expenses with the pre-tax dollars. So these plans have low monthly premiums, and then they include a tax-deductible health savings account as well. And then we also do have minimum value plans. These plans are going to meet the ACA standards and are very budget-friendly options with low copays and low monthly premiums. So if you don't go to the doctor very often and you just want some catastrophic event, this is a great option as well. Here's the plan comparison page. You can kind of see the different tiers. The copays are the deductible amounts. So you can see we have 3,500, 4,500, and 8,000 for individuals. I'm just going to leave that on the screen here so you can just take a look and see the side-by-side comparisons. And again, we want to be transparent. So this obviously this is subject to change, but this is the average monthly major medical pricing. And we are seeing on this that average cost savings is $330 a month versus legacy carriers like Blue Cross. And again, I'll just give you a moment to take a look here. And traditionally, we find that self-employed or 1099 workers have had access to mostly, EPOs and HMO networks with very limited coverage. And we're here to change that. We have a nationwide PPO network in 50 states, allowing for broad access to providers. We have out-of-network coverage allowing for some flexibility if you want to see a different doctor. And then again, we also do have that care coordination service. So you're going to get connected to fair price providers. And if you choose those providers, your care will be completely free. So these are just a couple things that we like to highlight that are part of your plans. Cool. So let's go ahead and take a look at the ClearShare plans. So what is a health share? Unlike traditional insurance, a health share is a membership-based model where individuals share medical expenses within a community. So it does focus more on mutual support, fostering a sense of connection and shared responsibility. Health shares like ClearShare from Clearwater are ideal for managing unexpected medical costs, and they offer more of a community-driven approach to healthcare. So this is a great solution for those seeking a cost-sharing alternative to traditional insurance. And we have a couple different options here within our health share. We have advanced, which if you use healthcare often, this is going to be a great option for you. We have reasonable monthly costs, no out of pocket when you use care coordination. And then again, you're going to have some great copays for common services like doctor visits, specialists, diagnostics, and prescriptions on this plan. Our second plan is our basic plan. So if you don't use the doctor too often, but you do want to focus on preventative care, then this would be a great plan for you. It also does have, that backup for catastrophic events. So if anything were to happen, it has that as well. So it is good for covering the basics. And then we also do have an HSA plan option within the health share. So again, this plan is good for pre-tax healthcare savings, and it does come with a health savings account. Here's the plan comparison here for the ClearShare health share plans. So I'll just leave that up here for a moment. We have 4 different tiers. It's going to be 1,000, 2,500, 5,000, and 10,000. And you can also get a ClearShare only plan as well if you didn't want to get these 3. Again, we want to be transparent, and this is what the average monthly ClearShare pricing would look like. So the annual max or maximum is the amount that a member is going to pay before the ClearShare community shares in medical expenses. So the annual maximum is also known as your personal responsibility. And ClearShare has 4 primary levels of personal responsibility, like I mentioned earlier, 1,000, 2,500, 5,000, and 10,000, which is new. If you have family members that are on your plan, they are going to have their own annual max to meet. Once the family's annual max is met, the ClearShare community will cover up to 100% of eligible medical expenses. So the exact amount does depend on the tier and the type of coverage you select, whether it's for an individual, couple, or family. Again, the annual max, this is going to apply to major medical expenses like emergency care, surgeries, hospital stays, physical therapy, and ambulance rides as well. So for our major medical plans, we don't have any limitations, but for our health share plans, we do. Um, any medical need related to conditions that existed before your membership are only shareable if the condition was considered cured and had no treatment for 12 months prior to your membership start date. And that's going to include, high blood pressure, high cholesterol, diabetes, thyroid conditions as well. And again, these are not going to be considered pre-membership conditions as long as you've not been hospitalized for them in the 12 months before the membership starts. For more severe conditions like cancer, heart disease, stroke, COPD, those are only going to be shareable if they were considered cured and required no treatment or examination or testing 5 years prior to your membership. And we do have a shareable amounts for pre-membership conditions. They are phased in. The first year is going to be a waiting period, so no sharing. Year two, it's going to be up to 25,000. Year three, up to 50,000. And then year four, it will go up to 125,000. And then after the fourth year of the membership, you will continue to be shareable up to a maximum of $125,000 per condition. If pregnancy occurs before your membership starts, it is unfortunately not eligible for sharing. However, if pregnancy happens after your membership begins, you're going to have access to a full range of maternity care services, including OBGYN visits, home births, birthing centers, and care from licensed midwives as well. And then one last thing I just want to mention here is members who do use tobacco will be charged a $50 surcharge. And then there is a $50,000 sharing limit for illnesses related to tobacco use. Perfect. So let's go ahead and dive into our holistic ClearShare plans. The holistic plans are designed to offer more of a comprehensive and natural approach to healthcare. So we do kind of mix the both here with these two plans, which is really great. We have two different options. We have the essential plan and the premium. The essential plan is built to provide strong coverage for major medical events, ensuring that you're protected. And then in addition to the traditional medical coverage, this plan includes holistic wellness benefits that support your overall health and well-being. So this plan is going to be great for those who want to have that protection and also want to have holistic services combined. Our premium plan is going to focus on reducing out-of-pocket costs for everyday common healthcare services. So if you do go to the doctor a little bit more often, but you want to blend it in some holistic, this would be a great plan for you as well. And I'll leave this up here. This is the plan comparison for the two holistic plans that we do offer. And you'll see here we offer chiropractic, acupuncture, which is, I think, very cool. And again, here's the average monthly holistic ClearShare pricing. So for the wellness reimbursement, with ClearShare, you can get reimbursed up to $50 per month for individuals and $75 per month for families. So here's just a list of what would be covered in those reimbursements. Fitness and gym memberships. So this includes, yoga, fitness passes, personal trainers, etc. Recovery services, so cryotherapy and cold plunge facilities are eligible as well. You can get reimbursed for weight loss apps, coaching programs, or in-person meetings. And then we also do reimburse for nutrition classes or counseling. And all of these are here to help you stay active and healthy. Perfect. So let's go ahead and jump into the supplemental options. Our dental plan, it does offer comprehensive coverage with 100% at preventative care. Basic services are covered at 80. Major services are covered at 50%. And then we have orthodontic covered at 25%. The plan allows you to use any licensed provider. So if you have a dentist that you already work with, we are more than happy to work with them as well. And then if for whatever reason they're not able to bill us, we offer reimbursement options as well. So it also includes a $2,000 annual limit per member and a $1,000 lifetime orthodontic limit per member. And you can see below here the monthly pricing. Our vision plan provides exceptional coverage, including 100% payment for vision services. We do allow $150 for materials like glasses, contacts, frames, lenses. With this plan, you are able to use any licensed provider, so you can choose who would like to work with. And again, reimbursements are available if providers are not able to build the plan. And you can see below the monthly pricing tier there. And then we do have extra coverage options that are here to give you just that financial safety net if something were to ever happen. We have accident coverage, so you can get up to $5,000 with the Pro plan or up to $10,000 with the Premier plan. We have critical illness coverage, so you can receive up to $10,000 with the Pro plan or $20,000 with the Premier plan for major illnesses. And then we also do offer hospital indemnity. That is not included in the bundles, but it is available for purchase at the time of enrollment. And you can see below the prices and the breakdown there as well. So as we wrap up, I do want to encourage you to schedule a meeting with one of our licensed benefits consultants. It is only 30 minutes, and they can assess your specific needs and help you choose the plan that is going to be the best for you and your family. We call it a needs analysis. They can take a look at the coverage you currently have and do some comparisons. Again, it is only 30 minutes. So if you're interested in that, go ahead and visit viago.clearwaterhealth.com/schedule. Again, thank you all so much for taking the time to explore these amazing healthcare benefits. I will go off now and I'll be available to answer any questions that you may have, and I will pop the link in the chat as well.
Hey, Kristen, there's just one quick question in
Yeah.
the chat, and then I have one if you don't mind.
Yeah.
The question in the chat was with respect to those that already are on Medicare. Do any of the plans or supplement that Medicare? And obviously, booking the appointment you just mentioned would be the best for each specific situation. But could you give a general answer to that question?
Yeah, absolutely. We can absolutely help with supplementals with Medicare. So if that's something, if you're on Medicare and you're looking into them, that is 100%, we can help with that. And you can sign up with our plans.
That's awesome. And then secondary, this share option that we have as part of being a member of Club Viago is just the United States, even though we are an international membership right now. Is that correct?
Yes, right now we are just United States.
And does that include Puerto Rico and US territories?
Yes. Mm-hmm.
Okay. And last but not least, do all the plans that you spoke about with us today meet the requirements for the US tax penalty for not having health care coverage?
I believe I will have to look that up really quick, but there is a couple states. that will have a penalty. I know California is one of them. One moment, let me see if I can find that. But we do have plans like those ACA ones that will meet that you can kind of couple in with other plans to meet the ACA standards. But if you are in, I know it's California, I'm trying to look and see what that would be, but
While you're checking that, can
yeah.
the additional services like the vision and dental that you ended with, can those be purchased without having to be part of another plan that is offered, or is that required first before the vision and dental are available for purchase?
No, that can be a la carte. So it does not need to be with any, yeah, if you just want dental or vision, that is offered a la carte. Let me get that information and I will send out. I saw some people asking for the recording. I'll get that information of the specific states that will get the penalty, and I'll send that along with the recording so everybody can have that as well.
Yeah. And family, we'll get the recording posted as soon as it's available. Kristen, thank you so very much for your time and going through it in
Absolutely.
detail. This is an awesome benefit, and hopefully, many of us now understand the value of it even more than before we had our time with you today. Thank you so
Awesome.
much, everyone. Thank you,
Thank you
Kristen.
all.